Hi there, Joe Valenzuela with Vista Mutual Insurance Services. Let's talk about Medicare Part D and some very important changes that are coming in 2024 and 2025. First of all, you may be asking, why are we talking about this in 2023? Well, I think it's important for everyone to know the upcoming information, as well as we're coming into the annual election period, the time where everyone can make a change for their plan, and that change goes effect in 2024. It starts October 15th and goes till December 7th. So it's pertinent information for you right now. And there have been some significant changes, and they're really all for the betterment of people that are on Medicare Part D. So let's get into the changes. The first major change, well, actually, let's talk about Part D in general first so that you can understand what these changes are. Part D is a program that was developed by the federal government. They do not sell it, though. They set the minimum standard for it, and it's sold through private health insurance companies that are approved to do so. Now, every Part D plan has to follow the set standard that Medicare creates, or be better than it. Most plans are, but the set standard goes a little something like this. You have an initial coverage limit, so you have an amount. Think of it like a donut or tire. That's why you see some people call it a donut hole. So you have this donut, right? This donut, and on the first side of this coverage is your initial coverage limit. Now, during this phase, you may have to pay a deductible. You have some cost sharing, as well as the company that's paying for your prescriptions has some cost sharing. Now, the total retail cost of this is what adds up to the initial coverage limit. So you may be paying $0 for your medications if you're getting them through the mail or even at the pharmacy, but there is a retail cost associated with them. Or you could be paying $100 for something that costs $10,000 a month. And yes, there are medications that cost that. So if you reach that initial coverage limit, that initial threshold, then you go into the coverage gap. Once you're in the coverage gap, now you're no longer responsible for 100%. You're only paying 25% of the cost for the medication, and the drug manufacturer, as well as Medicare, is paying a portion for the other side. So you pay 25%, but that could still be very significant if you were only paying $100 for that $10,000 drug, and then you hit that coverage gap, and now you have to pay 25% of the $10,000. It can still be pretty expensive. So on the other side of that donut or tire, remember, donut, tire, initial, you're in the coverage gap, you pay 25%. On the other side is the catastrophic coverage. Now, if you reach this, it's only 5% that you have to pay. So again, still pretty significant though in that scenario where you have a $10,000 medication. You're still paying a lot for that. So the first change that's going to happen in 2024 is the elimination of the 5% that you have to pay in the catastrophic coverage area. That means if you hit the catastrophic level, you will no longer have copayments. This is going to be really, really good for a lot of people out there. You may not know it, but there's a lot of people that are affected by very high-costing medications, especially brand name ones. And that's usually what this is about. If you have just generic medications, in most cases, you're not going to even hit these gaps. But if you're taking brand name medications, and remember, there are some medications that are not available in generic, they're only available brand name. And obviously, everything we say as insurance agents is from a cost standpoint. You should talk to your medical professional about the efficacy of any medication that you're taking. But let them know, because they may not know from the cost standpoint, because they think about it from their medical efficacy standpoint. Right? There may be alternative medications that treat the same condition that could work for you. So it doesn't hurt to ask them. So that's the major change in 2024. You'll no longer have to pay for the catastrophic phase if you reach it. So this is going to save countless people hundreds of thousands of dollars. They're setting the catastrophic threshold at $8,000 in 2024, which means as a Medicare recipient, if you were just taking brand name medications, you're pretty much only responsible for about $3,300 out of the year, and then everything will be covered for you. This is a massive, major improvement over how things are today. So that is the first one. In 2024, there will no longer be a catastrophic phase. Great. Also, they're going to do something that we thought should have happened a long time ago. There is something called LIS, or low income subsidy. Now, this is designed for people that meet certain income and asset requirements, and there were stages to this. If you were at 150% of the federal poverty level, you were put into a stage where you had to pay a small percentage of your medications. And this, with those expensive medications, could still sometimes be burdensome to somebody that's on a limited income. So they decided to give full LIS to everybody at 150% of the poverty level. So a lot of people that didn't qualify to get cheaper medications for, $2 and $8 or even $0 are now going to qualify for that. They're also going to qualify for the premium subsidy for the plan at full clip, meaning if you qualify for LIS, the state will pay for your drug portion of your plan premium up to a certain amount. So they're going to start doing this for people that are at 150% of the poverty level, effectively increasing the amount of people that are available for the subsidy. So this is a great thing too. A lot of people are right on that line where they're, 148% of poverty level and they have to pay a percentage, and it can still be pretty high. And this is going to lower them back down to the same with people that are at, 50%. So another increase in benefit and a good thing for Medicare recipients and Medicaid recipients, as well as Medi-Cal here in California. Now, what they're trying to do here is there was a law passed a while ago, and this is all a part of the Inflation Reduction Act as well, but there was a law passed a while ago that they wanted to remove the coverage gap altogether, meaning just give people a maximum out of pocket for their medications so that they know they'll never pay more than this amount. And in 2025, that is precisely what is going to happen. In 2025, starting January 1st, everyone will have a $2,000 maximum out-of-pocket spending cap on their prescription medications. So it's going to be great. There's going to be no donut hole at that point, and catastrophic coverage will have been eliminated the year before. So no donut hole, no catastrophic coverage, and you're going to get some amazing coverage for your prescription medications, and you're going to know that you can never spend over $2,000 in a year. This is going to help out so many people. Now, part of these things too was they helped out people that were taking insulin because they lowered all insulins to $35 regardless of what stage that you're in, catastrophic, the gap. So this is going to maintain the same for 2025, except for even if you just have insulin and you reach $2,000 max out of pocket, you're done. You're done for the year. So much like a maximum out of pocket for your medical plan, you'll have a separate maximum out of pocket for prescription drugs. And this will be on all plans, not just ones that, certain carriers or certain companies or certain states. This will be on all plans. So by 2025, we're hoping that many people that have struggled with the amount that prescription drugs cost right now will no longer have those struggles. We'll be able to budget accordingly and know that one little instance is not going to break the bank for them or possibly make them bankrupt, or even that they have to choose between a medication and food or rent or utilities that month. These are things we don't want people choosing from. Now, because of these changes, they're going to be shifting around some of the costs, and this is not so relevant to you, but just so you know, a lot of the costs for prescription drugs right now are paid by Medicare itself, and that is going to be changing. They're going to be pushing more costs onto the drug manufacturers to give you discounts for them, as well as more costs onto the Part D companies that supply you with the Part D plan, so the carriers of the insurance. So there's some shifting costs, and they're doing this in order to make sure that Medicare is still, has money inside of it for people, and they're trying to find a way to make sure that it's funded for the future. So one of the ways that they decided to do it is shifting those costs over to the manufacturers as well as to the carriers and away from Medicare. So just a little bit of difference. There's a bunch of percentages on that, but again, not something you truly need to know, just need to know how it's kind of working for you. Now, these changes are going to have huge impacts on our Medicare Part D enrollees. They're going to see significant decreases in the amount that they're spending on medications. They're going to see more affordable medications, and they're going to have a hard cap so that they know that they can budget accordingly and not have to go bankrupt. Again, I say that twice because I've been in these situations where I've talked to people and they're deciding whether they should take their drug or not take it anymore and just pass away. Not even between food and utilities and rent. I'm no longer going to be here. And that is a horrible thing for anyone in this country to have to decide. So we're making that better. Now, there's always going to be changes, and we're always going to try to keep you up to date with those changes. And although these changes are great overall, there's some people that might not be impacted by these at all, meaning they don't even spend $2,000 on their medications, and they don't qualify for low-income subsidy. They never get to their catastrophic or even donut hole stage, let alone catastrophic. So some people may see that everything's working the same as it used to be and think, well, I thought we were all supposed to get a reduction. No, it's just for the people that are getting to those higher areas. So if you're taking a lot of brand name medications, or even 2 or 3, or a very expensive one, this is who this is going to help. So you don't look at it as, oh, all my drugs are going to be cheaper next year. It may not affect you in that way. So just to recap, Medicare Part D is a great program, but there's going to be some very good enhancements in 2024 with the elimination of the catastrophic coverage. There's also going to be some great things that are going to happen in 2025 with the $2,000 maximum out of pocket, as well as the LIS, that's 2024, the LIS amount increasing for the people that have 150% of poverty level. So people that are struggling with their medications are going to finally get a break. And we have to wait a couple years to get it, but it's on the books. Now, could these laws and things change before then? Yes, they could. So we're bringing this information to you now based on what's available to us now. I think it would be kind of hard for them to change these, though. It's taken a long time to get here, and I think everyone is on board with going forward with how we're going to do this. So it's rare that I'm able to give you really good news for Medicare insurance, but that's what we believe this is, some incredible news for everyone that's on Medicare. So remember to like, comment, ask questions, and share this video. It helps us get engagement and continue making this content for you. For Vista Mutual Insurance Services, I'm Joe Valenzuela. Have a great day.